Go ahead.
All right, I'll do it. Good morning, everybody. Glad to have everybody on the call. Looks like we're adding up to about 74 participants on our call today. First thing, want to welcome all of our presenters that are coming to the meeting today, and our guests, as well as all of our members. Want to, most importantly, remind everybody at this point to please keep your phones as well as your computers muted unless you are speaking during this conference call and unless you're presenting. It will help us to be able, everybody to be able to hear what is going on and what is being said. So again, if you would, everybody go check right now and make sure your phones are muted as well as your computers. And again, I really appreciate everybody being here in the midst of everything that's going on. And want to take just a minute before I go over some more housekeeping things. Take just a minute to ask everybody that's joined this call this morning to please be in prayer for Andrea Chase, family, and Carey Counseling Services. Andrea Chase passed away on yesterday, and due to complications related to COVID. And so I know that their Carey Counseling is dealing with a lot, and Andrea's family as well. So we want to keep her family and Carey Counseling and all of her friends and everything in our prayers and our thoughts. So just like I said, we know this is some very difficult times that are going on right now. So just please keep her family in your thoughts and prayers, please. All right, moving on to some more housekeeping things. Just be aware that this meeting is taking place by conference call and being recorded per the, by the Governor Lee's Executive Order 51. A link to the executive order will be included in the minutes after our meeting, and the recording of this meeting will be posted on the Department of Mental Health and Substance Abuse website. As Kirby mentioned just a few minutes ago, for our attendance records, if you would, please make sure that if you're calling in by phone, that right after this call that you send an email to Kirby stating that you were in attendance at this meeting. As she said, if you joined by computer, your name is listed on there. And as it looks right now, there's 81 participants. But if you will email Kirby, and her email is kirby.fye@tn.gov. Again, that's kirby.fye@tn.gov. And just email her on the phone and let her know that you were in attendance today. As we go through, a reminder that I'll do is if there's any questions as the presenters are presenting, if you would, as you think about those questions, if you would, through the chat box that you see down below, if you will put your questions there, and then we will look at those and read those out loud for the presenters to respond to those questions that you have. The next thing that I want to look at is, as Kirby said, we do have a quorum here today. And so Avis, Amy, they have sent out the last couple of days information that's being covered today in our meeting. And so we have the minutes from our last meeting, which was on June 9th. And thank you, Albert. Albert covered that. I had planned to be there. We were on vacation at Dolphin Island, and the tropical storm came through, and then I could not get connected. So thank you, Albert, for covering. And so those minutes have been attached to the stuff sent out. So if you would take just a minute, look at that, or if you've already looked at that, if you would, through the chat box, we would like to take a motion for approval of those minutes. So if anyone, we need a
Madam Chair, this is Paul Fitchcar. I would love to make a motion to accept these minutes.
All right, thank you, Paul. Do we have a second?
Ricky Harris, second.
Ricky Harris, second. Thank you. Okay, if there are no opposition to that, then we will, if you have opposition, then if you would, send that through the chat box. If not, then those minutes will stand approved. Okay. At this time, Kirby, do we have Commissioner Williams on the call?
Hey, Kim.
You are. Thank you. All right, we're ready for your updates.
Fantastic. Well, I really appreciate the opportunity to be on the call. For whatever reason, my software stuff on my computer is not working, and I'm actually, Kim, in your neck of the woods in Jackson. I'm going to do a couple of meetings here. So, again, just really grateful for you all and the Planning and Policy Council, as well as our staff that do a yeoman's work of getting us prepared for this every quarter that we meet. What I wanted to start with is to bring you up to speed, and I know Kurt Hippel's on here. He may want to speak later about the legislative session that we find ourselves in, started yesterday. As you guys know, a couple of things that are important to our field, and that has to do with the ability for unlicensed practitioners to practice under a licensed practitioner through telehealth. That is something that we surely hope will get approved. The other thing that we're looking at and hoping will continue is the ability to allow LADACs to also work through telehealth. And that is something that's very important to us, as you all know. And just, again, we have an incredible group of people that have worked hard to put together feedback for this area. So that's one update I want to give. In addition, each year we have to turn in a customer-focused government plan. And I was delighted to see that our plan this year, based on last year's efforts, we did a phenomenal job, even with what's going on with COVID-19, to be able to respond to those concerns and those areas that we have focused on across the state. In particular, we were able to hit it out of the park on the behavioral health safety net. As you guys know, we expanded the percentage of federal poverty level to serve up to 39,000 Tennesseans. And what we've done, again, through our provider network, was 39,034 Tennesseans last year were served, with our goal being 39,000. So we did a really good job there. In addition, when we looked at the services that we would provide through new initiatives such as the faith-based work, as well as the SOAR work, and I know some of our staff will be talking some about that. We also hit that out of the park, again, even with what was going on with COVID-19. So grateful for our provider network that turned on a dime and really retooled and refocused their efforts to be able to serve Tennesseans that are struggling through a different modality, which is telehealth. I'm excited to report to you that we are moving forward with the school-based behavioral health liaisons expansion. We're grateful that that was funded. So every county will have a school-based behavioral health liaison coverage. In addition, the Safety Net for Kids is going live September 1. And we're excited about that project because if you think about it, even though we don't have Medicaid expansion in this state, the ability for our providers to couple the adult safety net with the kids safety net means we really are able to serve uninsured Tennessean families with all the services that are needed to get you back on your feet in recovery and to promote resiliency. That's pretty amazing. I don't know of many states that are able to do that. Finally, you've heard some about the program that we've done with ECHO, as well as the Hub and Spoke under Assistant Commissioner Taryn Sloss's shop. They have done really good work there in connecting up people that are in need of treatment services. I did get questions that I was asked to respond to today, and if you will give me a minute to pull that up, I will start with that. So what is the future of telehealth? This came from Region 2. Again, our goal is to support telehealth because we know it's an important tool in the toolbox to serve people. I can't predict what the future holds, but I can tell you that we are advocating for that because we know it is beneficial across the state. The next question was, what media strategies will educate the public about available behavioral health options, including grant-funded services? This also came from Region 2. I will tell you that we have been working with Matthew Perriott. Matthew is our Director of Public Relations and all things public information. He's amazing. And then his staff member. And Leslie, and what we're hoping for is a plan that will encompass those key services for Tennesseans, both in the mental health realm and the substance abuse realm, to get out the word that they are here, that we have services that are here. Obviously, a lot of people know about our services because combined we almost served over 300,000 Tennesseans last year, but there's still room to grow, and we are focused on that. Obviously, our website as well as the Facebook site is something that we utilize to get out the word. Leslie does a great job of daily inspirational statements that she puts on our Facebook. And obviously the local providers also do their own strategies around announcing what services are available. So we hope to continue and work collaboratively with that. One of the things that we got asked is what strategies are in place to address children's mental health needs with kids not going to school in person or to deal with emotional consequences of COVID-19. Really appreciate that question. There was a document that was put together by the Department of Education, and our department and several other departments participated in that document. If Matt is on the phone, Matt, can you tell them what the name of the document is? Because I'm absolutely blanking on that.
Hey, good morning, everybody. I believe the name ended up being just Child Wellbeing COVID-19 Update. I think that was the final name. I can confirm here in 1 second, though.
Thank you, Matt. I appreciate that. So I would encourage you to just Google that. If you just Google Department of Education COVID-19 Child Wellbeing, it'll come up, I'm sure. The other thing, Avis, if we could, and Kirby, if we could send that out to people, that would also be helpful if we could send it out to individuals that were on here today. A lot of great information and great strategies about what we're doing. Again, obviously, having the safety net for kids plus school-based behavioral health liaisons are going to go a long way in this next year to respond to those needs. And the other thing that I'd point you to, Dr. Edwina Chappell did an incredible document several years ago about evidence-based practices for children's services that holds true today. I actually pulled it out when we were looking at the response with education, and it is a great document, incredible information that really does hold true today. So I would encourage people to take a look at that. When we're looking at the budget update, obviously what I shared with you all is we moved forward with a plan that did not include any cuts to the community in the first year. and I'm very hopeful that that's going to be accepted. We're waiting to hear back from the governor's office and FNA about what will be included in the budget going forward for this year. I promise we'll let you guys know as soon as we know. And then let me see, there's one more question. Any new strategies to address increased opioid overdoses since COVID-19? Obviously, we're tracking the trends, very concerned about the increased overdoses. And what we know is the data showing us it's actually from fentanyl-laced street drugs is where those overdoses are occurring. And if Taryn Sloss, Assistant Commissioner Sloss, are you on this line?
Yes, ma'am, I am here.
All righty, Assistant Commissioner Sloss, would you mind speaking to that particular question?
So, yes, thank you, Commissioner. So, yes, we are well aware of the overdoses, the increase in overdoses during COVID-19. We have particularly seen overdoses increase in Davidson County and Shelby County, and I believe it's one other additional county now that's showing up in East Tennessee. Well, it escapes me right now. But we've been working closely with the Davidson County Health Department, and also with the Shelby County Health Department, along with our community-based coalitions and our regional overdose prevention specialists, to get the word out about naloxone, to do additional education. As you know, that's been a challenge with COVID, so we cannot host groups, but we're doing drop-offs at areas of highest needs. People have been contacting us through the new Tennessee Recovery app prevention module. We have been responding to needs for naloxone there. And then also we have been working with both those counties on and doing some more media in those areas to let community know about the increases in overdoses and how they can get assistance. So thank you, Commissioner.
Absolutely. Thank you, Taryn. In closing, I'd like to do a shout out to our Deputy Commissioner, Heather Gunderson, who has absolutely responded to any community behavioral health need related to PPE. She's done incredible work and has represented us well and allowed us to access resources that many people cannot access. She's really been incredible with that. And then finally, Matt Yancey, who continues to lead the provider calls each week, does so in an elegant and easy manner, which we appreciate, and always keeps you informed with where we're at. With that, Kim, I will turn it back over to you. And if there are any questions people have, I'm available, and I'll be on here until noon.
Thank you so much, Commissioner. Appreciate all of your information. As always, appreciate you and your department for everything that you're doing and continue to do day to day through COVID-19, everything else that's going on in our nation. You guys, as always, and as we expect, have definitely stepped up and helped us as providers. And so we definitely appreciate that. You mentioned something about things that, are done in Tennessee that you've not necessarily seen across the state, and this time and time again, I continue to see that, and all the hard work from you and your department, we greatly appreciate that. Does anybody have any questions for the Commissioner before we move on to the next thing? Chat. Oh, you're welcome.
Kim, this is Avis. Hi, Kim. Just wanted to let everybody know, Matt did link, if you haven't checked the chat box, the link to the Child Wellbeing Task Force report with COVID-19. That's in the chat box. Kirby will also send this out via email after the meeting, but that information is in the chat box.
All righty. If we have questions that come up, we will go ahead and read those out, but we will go ahead and move forward with our reports. And so we will start with the regional council reports. And so if we could have the chair for Region 1 to give us a report on your last meeting.
Thank you. This is Tim Perry with Frontier and Region 1. Region 1 Policy and Planning Council met on August the 4th at 10 a.m. Chair reminded the participants that the council is continuing to work on updating membership roster and providing applications to members as needed. There was also an update from Frontier Health reopening of clinics, being both virtual and in person, that were given by Sam Stagel. We also had a report from the regional school systems plans for reopening schools in their area and the safety precautions that are being taken. Also, with the new law requiring schools to have child abuse reporting coordinators for every school. Also, there was an update with Trace's foster care program for Northeast Tennessee. The chair also reminded the members to continue to think about the needs for our area in reference to the needs assessment and how that some of our needs may be changing due to the COVID-19 pandemic. Then there was reports from the adult committee.
Tim, are you still there?
Or is it? Am I going to be heard yet?
I can hear you now.
Okay. Were you able to hear me to begin with, or?
Yes, just for a brief minute you went out, and so trying to think of where you said the adult committee, and then we lost you.
Okay. There was a report from the adult committee about Frontier Health being awarded a SAMHSA COVID-19 grant for a crisis hotline for COVID-19. There was also a report by the CNY committee about school-based behavioral health services in our area, where those services were and what schools they were in. Also an update about the behavioral health safety net for children. MCOs, there's a report from Erica Bryant with UHC about UHC's plans to continue expansion of telehealth following TennCare guidelines, and about their support to the communities versus transitional living, about food box distribution, and also about leadership calls with TAMHO, the department, and TennCare regarding COVID-19 updates. Jill Stout gave a report for TCCY about the council being offered WebEx trainings to continue, some on diversity and other issues, starting with a 3-part series August the 18th. Kirby was there and gave a report for the department, and then Zach Blair was there and gave an update on the legislative summary report about current legislation. The next Region 1 meeting will be November the 17th at 10 a.m. That's our report.
Great. Thank you, Tim. A lot going on. You mentioned the crisis counseling program for the COVID-19. That's just another thing that I would like to thank the department for pulling that together, such a quick turnaround. And as I've been on those calls across the state, the hotline seems to be up and going across the state, and some great things happening there, providing resources and assistance and emotional support to those people that are struggling, that are not quite so, resilient during these difficult times. So thanks for bringing that up. Okay, let's move on to Region 2.
Hi, I'm Mary Nell Osborne, Region 2, and I want to let everyone know that we did meet May 13th. Our meeting in the region is tomorrow. So I don't have a lot of new news to report on. Reflecting back, though, since May, our committees, to my knowledge, have not met. I'll learn more tomorrow. But we did welcome some new members to the meeting, particularly Allie Collin with the Creating Homes Initiative through Ridgeview, Jessica Colton, the new homeless coordinator at Helen Ross, Amanda Millsap, regional housing facilitator through Helen Ross McNabb, and what we participated in since May was really a rigorous evaluation and updating of our committee membership database and a directory and getting everybody's applications in place. So I think I want to do a particular shout out and thank Chris Roberts, the Secretary for Region 2, and for her tireless efforts, and Kirby in that project as well. I feel like we really know where we need to expand our membership and who we have sitting at the table and around the Zoom or whatever. So thank you to all those folks who were involved in that. The general overview of the report is that we do want to thank the Commissioner and her efforts and the department's support of agencies and consumer groups at this time in meeting the COVID pandemic requirements head on. Patients continue to be served. We continue to have crises. We continue to get people connected to peer support. And we are learning more about where our gaps in technology are. I think our focus now is kids going back to school. I'm glad to hear about the school-based initiatives continuing to grow and expand. Thank you for that. And we continue to have children and adolescents who are, have lost their anchors, schools, social relationships, all of those things. So we are continuing to find ways where we can connect kids and to the support. We're learning over here in East Tennessee, in this region, the challenges of our geography. And I know everybody struggles with that. People having to drive up to the top of the mountain to get a signal or connect to Wi-Fi sitting outside somewhere. So we're really, I hope this pandemic will help us to build a strong infrastructure for the future, which is going to include technology. And for some of our folks, it really, really works. We're hearing really good stories about people who appreciate not having to get in a van and ride 2 hours to go to an appointment, and they can have a virtual appointment. They don't have to have the social anxiety or the physical hardship of that event. Medical providers are really connecting more with peer agencies. They're making referrals, and I think they're understanding and appreciating peer programs more. I'm hearing that from the peer programs across all the agencies and then the consumer agencies as well. As I said, our next meeting is tomorrow, and I'm sure I'll have more to report at that time. We have had some virtual events. There was a virtual NAMI walk that was very successful. And I want to again reach out and offer thanks to the health departments across the region as well in their efforts to test and track and treat COVID. As we said earlier, it's starting to get closer and closer to the folks that we personally know. So my condolences to Carrie. There is a TNNADD conference on August 20th that is going to be virtual, and that's really all I have. I'm going to ask if anybody else has an announcement that I didn't catch.
Hey, Mary Beth. This is Marie Williams. I want to thank you for the update on peer services. That's something that we've been concerned about during COVID-19, and what you're describing is very hopeful that the telehealth work is being well received, as well as your information about doctors referring to peer services. Really, really appreciate that update. Thank you.
Commissioner, thank you. Also, we just started something in the Peninsula Peer programs also. We're sending out a newsletter of support for the professionals working in the field. Anybody can send it anywhere, but we're including articles of interest, but also reminding them about the importance of self-care. There's nobody that knows recovery like peer professionals. So thank you for that. And yes, I agree. They're coming through with stellar performance.
Thank you.
Thank you, Mary Nell. Appreciate that report. Some great information. And we want to make sure we point out all those positive things that we're seeing as a result of telehealth and being able to make sure that our patients, our clients, are getting connected to the services that they so greatly need. All right, let's move on to Region 3.
Hi, good morning. Can you hear me?
We can.
Good morning. This is Deanna King with East Villages. We met on July 16th. And one of the things that we talked about is we've had some difficulty with committee participation, specifically our adult committee and our legislative policy committee. So we've really been trying to hit home the importance of these subcommittees and the purposes, again, of policy council meetings. The Child and Youth Committee is hard at work collecting data from the completed needs assessment, and they are forward-thinking as well for next year needs assessments to make sure that we have strong data for those goals. Some reports from our region. CADIS has increased detox bed by 24, so that's exciting. Helen Ross opened its therapeutic preschool IOP for children ages 4 to 6. The Peer Support Conference will be held October 8th through 9th via Zoom. And NAMI continues to also have support and resources for those in the community. So those are just some of the reports that we had, again, focusing on our subcommittee and the importance of the involvement in those subcommittees as well. Thank you so much.
Thank you, Deanna. All right. Region 4.
Yes, thank you. This is Robin from NAMI-Davidson County. Region 4 met on Wednesday, August 5th. We had approximately 15 people in attendance via conference call and Sunday video. I want to thank Kirby Fye, Zach Blair, and Kurt Hipple and Ava Thiesley, who were in attendance from the department, and Kirby provided us with a summary of activities and ongoing efforts of the department. Zach gave a legislative summary of the last session, which we really appreciate. And we really want to say thank you for having these folks available to us and being so accessible for us to be able to ask questions and get information in such a quick manner. I want to give a shout out to our legislative policy chair, Elliot Pinsley. We had submitted with his leadership a couple of proposals for the legislative proposal request. And one that he had put forth was a proposal to remove the word abuse from the department's official name in an effort to reduce stigma and align with movements across the country for such considerations. We understand that right now there's a lot going on, and so we want to at least bring awareness to this issue because language is important. So just wanted to thank him for that effort. Our MCOs reported their activities related to online services. Cooper Urkel Bryant was present on the call for United Healthcare and gave us an update of telehealth within there. Mayor Group could not be present on the call, but did share some information, and I'm sure we will have information from Blue Care, which will be shared via email with our members. Servine Johnson was in attendance from our Children's Committee. They are going to be working on the upcoming quarter and activities there. We gave very intentional time to checking in with our members. We really feel it's important to acknowledge the impact on professionals and the formal peer supports within the mental health system. And so we really encouraged people to report what they were doing for self-care and any announcements, what they were doing with each other. So we had a lot of evidence of resilience, resourcefulness, and just collaboration among our council members and how they were supporting each other and meeting the needs of the people that we serve. And so we really appreciated that. One of the things with Davidson County, we're very rich in professional resources. And so I think it's really important that we underscore the importance of self-care to professionals. And we made sure that everyone was aware of the new helpline that is available to professionals. Attendees were asked to look at the needs assessments and just kind of take a look at that in light of what we put forth in the spring and what we may want to look at in light of COVID, things that may have changed, and that's definitely going to be part of what we look at in the November meeting. We did ask our current members to begin sending an updated meeting forms for membership forms so that we can make sure that everybody that we have in our membership is reported appropriately in line with the new format the department is keeping to keep up with folks, and Secretary Rusty Totten Emerson will be helping with that. Our next meeting will be November 4th at 10 a.m. and most likely, I'm sure you all know, online. And if anyone has any questions, I'll be definitely happy to try to answer those, and if not, I will thank you for the opportunity to share this report.
Thank you, Robin. Appreciate that. All right, let's move on to Region 5.
Good morning. Can you hear me, Kim?
We can, yes.
We met on August the 6th. We did it through Via Health, through the telehealth systems. We had Jennifer Armstrong and Melissa Sparks to come and to talk with us about the crisis services and how COVID-19 has impacted those services. One of the things that we learned that we are almost at 100% telehealth capable in our emergency rooms. And we continue to work on breaking down those barriers. And also with regard to the jail, the jails through the state are almost fully equipped for telehealth capabilities, yay. And they'll continue to work toward 100% of that. That has helped with addressing those who are appropriate for admission to the institutes and those who are not. And it also is a savings for law enforcement. The department also, they talked about rolling out 2 new items. One was a medical clearance checklist to help in the ERs to move the clients through a quicker placement. The other one that they talked quite a bit about was the new SMART form. And this was a medical clearance process as an evidence base that was started in California, and Melissa has tweaked it where it fits Tennessee. And it's designed to streamline the medical clearance process as it relates to transferring a psychiatric client to an inpatient facility. Dr. Herman and the department have been working with the ERs on this, and they've run into one small barrier, and that is many facilities have different medical clearance criteria. So this is something that will continue to be worked on, but they were really excited about that. They actually sent us the link that we will get out to all of our membership. There was a lot of discussion, as you've heard on the phone today, about telehealth now as a primary choice in lieu of face-to-face. Melissa talked about they had been monitoring because there was some concern, would we get the same quality of assessments? and the monitoring thus far has revealed that the quality has not suffered. Did talk about the fact that the Crisis Stabilization Unit has had some limitation in trying to comply with the social distance, which has impacted the diversionary services. But everybody's working together. So while one may have one issue, somebody else picks up the slack. And so the partnership with the state and all of our community partners has been a godsend as we work through this COVID-19. I heard somebody else mention, I think it was Region 4 that just mentioned, they talked about self-help and self-care. And that was one of the things that we talked about also. And some of the things they came up with was people using their PTO for self-care along with providing some coping skills with staff on Mondays. So they start their Mondays out on a positive note and how we're going to be positive going forward. Now, Commissioner, they have not started singing a song yet, as you do, but they're working towards that. We just ain't got that same level there as you do. So maybe you can rub off on some of the rest of us. They talked about, they shared a video that was a burnout series with members to try to help them to recognize when burnout may be beginning, and then let's utilize some positive coping skills. Someone also referenced a free app called COVID Coach. It was designed by the VA. And quite honestly, I have not downloaded it yet, but it was spoken very highly of. That could be used for anybody, but it was developed by the VA. They also have a team where they have their team to provide a list of gratitude things, 3 to 5 items. And for those who share, they put their names in a drawing for something fun at the end of the week. Just kind of morale booster. And they provide weekly one-to-one check with the staff. We had Zach also. I'm not going to go through that because I think Region 1 did a great job with that this morning. And the other regions talked about the updates that the department has given, so I won't restate that. The other thing that was asked about was a list of resources by county. And we talked about how hard that is to keep that freshly updated. And we also referenced the person who was from Montgomery County was wanting to know, we made sure they had the department's website, the crisis statewide phone numbers, the Tennessee Red Line number. We gave them all kinds of numbers and let them, and that that mustard yellow banner. We made sure they knew about that. That right now, that was the best place to get a list of resources and to get people was to call those numbers. The state's invested in them. Those agencies are running them, and to call them for help. And let's see, if I scroll down through here, I don't think I have anything else except our next meeting will be November the 5th. And thank you very much, Kim.
Thanks a lot, Debbie. Appreciate all of that. All right, that moves us on to Richard Barber in Region 6.
Good morning, everybody. Can you hear me, Kim?
We can.
All right. I'll try not to get too loud. Just want to co-sign what you said with our friends at Care Counseling. You know, here in West Tennessee, we've all worked together for years, and what a tragic loss in Andrea, and our thoughts and prayers are with her family and with our friends at Care. Region 6 met on July 14th via web. We thank Kirby for getting that set up for us. We had 13 members on the call. Zach Blair was on and gave the legislative update. And like Debbie said, no use going back over that. And Kirby gave the department report. We appreciate them being a part of that. We had the adult committee report. Jerry and Megan gave an update on the children's committee and how they're working with some things in the schools with behavioral health. Most of the meeting revolved around some things like an internal audit we did with Region 6, where we wanted to look at our consumer participation and then get more involved in some of the legislative initiatives that we see and the department has. Matt Marshall with the United Way of West Tennessee presented, talked about the local resources that we have for COVID-19 and invited everybody to their weekly calls where they updated and continue to update resources. Just also want to co-sign the peer support program for substance abuse. You know, in substance abuse treatment for years, we've used recovering people, and I think a lot of times people think because they're in recovery, they should work in treatment. Certainly, they have things to share, but I think what the training for peer support does is allow those people the necessary skills and the training to tell the difference between sharing their story in a 12-step meeting and actually working in a therapeutic environment with the ethics training they get, the cultural sensitivity training they get, the things that they don't get in a 12-step meeting that makes them really more professional. So certainly we want to thank the department for their support. During all of this, y'all, we're living in interesting times, and I guess if we live long enough, that always happens. But I'd just like to thank everybody for the way everybody comes together and tries to find the solution. You know, there's not a playbook for this. None of us have ever been through it. So I appreciate everybody I've been able to lean on to get the help I need. Our next Region 6 meeting will be October 13th, and we're assuming that's going to be via WebEx too. Thank you.
Thank you, Richard. Appreciate it. All right, that moves us to Region 7.
Good morning, everyone. Can you hear me?
We can.
This is Bartholomew Allen with Region 7. Region 7 met on Tuesday, July 28th at 11:30. We opened with our welcomes and introductions and approval of the minutes. Mr. Zach Blair, as the other regions have stated, gave the legislative update. Kirby gave the department update. And we also had an agency presentation by Ms. Cecilia Johnson Powell. She's the director of Driving the Dream. Driving the Dream is an agency here. And it's also an initiative of the United Way of the Mid-South where they try to improve the lives of second-generation families by facilitating networking and local agencies and the services they offer. So we had a presentation by Ms. Powell, did a wonderful job. And then we also had a lot of updates and discussion as it pertains to COVID-19 and how it is affecting and how it has affected some of the agencies. Agencies got a chance to provide any notes that were related to their openings and their times of opening. We had Mr. Butch Odom, which is our region secretary, and he's also our amateur epidemiologist. He works with an agency here in Memphis. He provided updates on COVID testing and some of the recent delays that were related to COVID testing here in Shelby County and the spike in COVID-related and the COVID-related problems that were occurring here in Memphis, Tennessee. I'm sorry. Lindsay Blevins mentioned Lakeside is offering free opportunities for CEUs, really big things that we were trying to push for CEUs during this time. Mr. Justin Johnson of Tennessee Suicide Prevention Network announced a number of virtual trainings through TSPN. You can visit those on their website. Mr. Kevin Spradlin with the Memphis Fire Department announced that talks are underway to try and add mental health professionals to calls for people who are experiencing mental health crisis, as opposed to sending them to the police. So the fire department and police are working hand in hand on trying to get individuals who are calling in with mental health related issues to the help they need as soon as possible. Mr. Tom Sterling announced that there are screeners that are available at the Mental Health America website. Ms. Kubra also gave an update for the United Healthcare Community Plan. They've been working on expanding telehealth, as mentioned earlier, increase support to the different providers around Shelby County, and they've also been working on holding weekly leadership calls with provider leadership with Tamho and the department. Our next meeting for Region 7 will be on October 27th via WebEx at 11:30 a.m. And that's it.
All right. Thank you, Bartholomew. Appreciate that. What was the date of that next meeting?
October 27th.
Okay, thank you.
No problem.
All right. Thank you all for regional councils for giving your reports. Let's move on to Ginger and the Adult Committee.
Good morning. Thank you for the opportunity to share. We met via conference call on July 15th, and Jeannie Price, the statewide regional housing director, spoke to us about the new T2 housing facilitators who will be focusing on developing recovery housing across the state. She was able to also share their specific names and contact numbers so the regions can reach out to these T2 facilitators. And just a shout out to all the regions I think the T2 facilitators is in part a response to our needs assessment, where many of the regions had emphasized the need for recovery housing. So it's very exciting to see the connection between the needs assessment and then the programs that get developed out of that. So thank everybody in the department for making that happen. And like many of the regions shared, we spent the second half of our meeting focused on the challenges that COVID has offered to our folks across the state, the adjustments that we've made to meet those challenges, and the hopes that we have for the future. Our next call will be focused on starting to build our rationale for our needs assessment for the spring. And I'm sorry I don't have the date of that meeting available for you, but there'll be notices sent out in advance. Thank you.
Hey, Ginger.
Yes, ma'am.
Thank you so much for the shout out on our department paying attention to the needs assessment, because we do. We take very seriously what you all say to us. Some years we're more successful than others, but we really do pay attention to what y'all say. The whole leadership team does. So we so appreciate y'all's work and the feedback that you give us. So thank you for acknowledging that.
Thank you.
All right. Thank you, Ginger. Appreciate that. Now we move on to Ricky Harris and the Children's Committee.
Hello, good morning. I want to echo and first just offer my condolences again to Carey Counseling. Andrea was a very important part of the fabric of the work in children's services, and I've heard it said children are 30% of the population and 100% of our future, and this is important work, and she will be greatly missed. With that, we had two presentations in our meeting, and the first was from Elizabeth Steady-Reeves over the Juvenile Justice Reform Program with the Department of Mental Health. And she offered some updates I thought were important and wanted to pass along. After 19 months of services in that program, at six providers across the state have delivered services, 1,251 admissions, and they are all delivering evidence-based interventions to youth involved in juvenile justice programs. And I think it's incredible work that they're doing, and I think it's amazing that we are gathering data on some of the effectiveness of these evidence-based programs here in Tennessee, specific to our state, and how the services will reduce youth justice involvement. So it's a very exciting report to hear, and grateful for that work through the department. And then there was a second presentation from Department of Children's Services discussing the Family First Prevention Service Act. And if you are doing children's work and you're not familiar with this, I would encourage you to hop on the website at Department of Children's Services and read up on this Family First Prevention Act. It is a federally funded program that is intended to transform child welfare across the country, and it's based on evidence-based prevention services. The Department of Children's Services has posted a map of the evidence-based practices across Tennessee. I think it's very interesting to kind of see how they've mapped out what evidence services are being delivered in what counties. So again, if you're in children's work, I encourage you to look at that. DCS has an implementation target date of July 2021. And just want to also note that I appreciate the involvement that the Department of Mental Health staff have had in their partnership with DCS on getting some of these evidence-based practices on the map for them to track. So good presentations, always helpful in gathering up the data that we need to begin formulating our needs assessment next time. And our next meeting is November 4th.
Thank you, Ricky. Appreciate that. Let's hear now from the Consumer Advisory Board with Dina.
Good morning, everyone. This is Dina Savanaugh. Can you all hear me? Hello, good morning.
Yes, we can hear you.
Okay, wonderful. Thank you so much, Kim. Good morning, everyone. The Consumer Advisory Board meets the first Friday of each month, and as of June 5th, via WebEx. We'd like to report that we heard presentations from the following resource speakers: Sherry Barnett, who is with the Regional Overdose Prevention Specialist Program; Jeff Clayton, the Executive Director of NAMI Tennessee. And we were inspired by recovery stories from the following: Sherry Barnett, CPRS, and Nancy Killen, CPRS. They both shared their personal and uplifting stories of recovery. We, too, have set aside time each month to share wellness tips and just support one another, which has been especially meaningful during these times we find ourselves in. We added a new regular update to the agenda from the newly formed Tennessee Association of Peer Specialists, also known as TAPS. Barbara Ann Nelson gave the first update at our meeting in August. Our workshop presenters have been selected and confirmed for our CPRS conference, Roaring into the Future with 2020 Vision, for October 8th and 9th. We will be using Zoom as our virtual platform. Final details about the exact schedule are still being determined. We are continuing to utilize the WebEx platform, like many of you, for our monthly meetings until further notice. And finally, we have 4 membership openings. 1 in Region 1 for a person with lived experience in mental illness, 1 in Region 2 for mental illness, 1 in Region 4 for mental illness, and 1 in Region 6 for mental illness. If you're interested in more information about the CAB, please feel free to contact me, Dina Savanaugh, at csavanas@tamho.org. That's CSAVVENAS@tamho.org. Or you can contact Kathy Haley, Lisa Reagan, or Michelle Webster. Our next meeting is scheduled for September 11th from 9 to 11 Central Time. And we also want to extend our condolences to Carrie and the family of Andrea Chase as well. Thank you so much.
Thank you, Dina. Appreciate all of that. The executive committee met on June the 16th, and we met jointly with the legislative committee. Zach Blair was present on the WebEx and provided a follow-up to the legislative proposals that were made. And with that being said, I will not take Debbie's thunder and allow her to give the legislative committee report. Debbie?
Good morning. I am, the computer and I are having trouble as I bring up that report, so if you'll bear with me just one moment. It popped up as an Adobe. Sorry about that. All right. The legislative committee and the executive committee did meet on June the 16th, and as previously noted, Zach provided an update on the meeting with Commissioner Williams regarding the two proposals. One was reducing stigma to changing the department's name. Zach advised that Commissioner Williams was not opposed to the proposal. However, the timing is an issue right now, and he informed the committee that the department had been through several name changes in the last few years, and it's created confusion within the legislative body and the community. That the committee, the main consideration moving forward is to make sure to eliminate the confusion regarding the department's roles, the jurisdiction, what's regulated, and who we serve. So Kurt suggested that the committee that we present this proposal again next year. And there was also, we talked about the workforce shortage survey. That's a mouthful. Zach advised the committee that the department is going to work with the Tennessee Department of Health on this proposal. And however, while the Tennessee Department of Health may be on board with this recommendation, they're currently focused on the COVID. And so maybe Zach could get something being handled outside the legislative and rulemaking process. And in summary, Zach gave a brief overview of the legislative process that had gone up and relating to the new budget and upcoming fiscal year. And with that, the meeting was adjourned.
Thank you, Debbie. Appreciate that. We're a little ahead of schedule, but Kirby, unless you have something or if anybody to give a statement or anything, we will move on to Zach Blair to give us an update on the 2020 legislative summary.
Good morning, Kim, and good morning, everyone. Thank you so much for giving me some time today, and I will apologize for in advance for being brief. I do have responsibilities to monitor the social session that is going on right now, so I'm watching about 3 video streams at the same time, so with my laptop won't catch on fire as well. We'll see how much capacity that has for working on multiple things. I'm going to attempt to share the legislative summary on your screen. And please let me know if that is coming through.
Yes, sir.
Kim, I can see you on the screen. Let me
Yes.
know if you're reading the document.
I can see it. Yeah, it's there. Thanks.
It's lovely, Zach.
I'll not go bill by bill on this document, but I do want to highlight a few things that I think will get interest to this group, and then like I've done with the regional council, happy to answer any questions about the legislative session that is past and now again ongoing, and also answer any questions about specific bills you may have reviewed or have questions on at the end of this presentation. So just to give you a brief overview of kind of what's happened so far, the legislature met in their normal session until March. The COVID pandemic really picked up and cases started building in Tennessee. They adjourned in the middle of March, which is very unusual, and then came back from a lengthy recess on June the 1st and finished their business and passed an amended budget to deal with the realities of the revenue situation that we're dealing with here in the state. So that session adjourned in the middle of June, and we are now in a special session or an extraordinary session to deal with some specific topics related to COVID. One, dealing with the liability protections for businesses. Two, dealing with the delivery of medicine through electronic means, and then finally, part of the call for the extraordinary session is to address issues surrounding damage of state property when protests are occurring. So those are the items that the legislature is dealing with this week, and I know that they're probably hoping to be complete with their business on Thursday or Friday. So I'm in the middle of watching that. I know the telehealth legislation and the liability legislation will be of interest to this group moving forward, and those will be added to the summary in the event that they pass during this week of the extraordinary session. So I'm going to begin with page 1 here. And the last bill listed is, and it is not a bill, but it is a legislative action, HJR 1, which is a joint resolution of the General Assembly that recognizes teen suicide as a health crisis in Tennessee. And joint resolutions, while they don't mandate action specifically in this circumstance, they do recognize certain positions and policies that the legislature has deemed important, and understanding that teen suicide is a health crisis in Tennessee is one of those policy statements that the legislature made this year. So HJR 1, and all of these, the public chapters, which are the full bills in their final form, are linked, so you can click on any of those links to see the full text of either the new law or the resolution that's listed on this document. Going into the substance abuse and controlled substances related legislation, the first bill that I want to touch on is Senate Bill 22, House Bill 2269, now Public Chapter 732, which is the second bill on this page. As you know, the federal government made a change in the minimum age to purchase tobacco products. That moved from 18 years of age to 21 years of age. And the reason why that's of interest to our department is we participate with the Department of Agriculture here in Tennessee, which is the regulatory authority for retail tobacco, and we assist them in trying to determine the underage compliance rate for tobacco retailers in Tennessee. And it was their opinion, in order to continue to enforce that they would need to have the state law mirror the federal law in this bill, which is an administration bill, accomplish that. The reason why that's important for our department is our block grant funding, the substance abuse block grant specifically, is contingent on that as a piece for eligibility, keeping our compliance rate for underage sales tobacco products at an acceptable level. So it was important that we continue to be able to assist them with the enforcement of that and ensure that we are compliant there, and to ensure that our block grant funding is not jeopardized by enforcement through the Department of Agriculture. So again, that bill just simply mirrors the new federal requirement related to the purchase of tobacco products. I apologize. I used to be with ABC, so anytime I talk about retail sales, I usually revert back to alcohol, but this is tobacco sales in this particular bill. The next bill I want to touch on is Senate Bill 2552, House Bill 2625, now Public Chapter 747. This requires the Departments of Health, Mental Health and Substance Abuse Services, and the Division of TennCare to collaborate to develop educational materials, specifically for the providers and facilities who use medication-assisted treatment, and to make those available so that they are further educated on the impact of neonatal abstinence syndrome and the ability to have the appropriate conversation awareness for pregnant mothers or of childbearing age, or that may soon become pregnant. And so that's something that we will be collaborating with the other departments listed in this bill to make those materials available. The next two bills, and I'm going to try to scroll here between two pages so you can see them at the same time. These bills deal with very similar topics, but the setting that they regulate and the conditions by which the activity is permitted are a little different. I'll do my best to distinguish between the two. But the first bill on the list, up on page 2 here, is Senate Bill 1060, House Bill 656, which is now Public Chapter 761. This bill will allow nurse practitioners and physician assistants for the first time to prescribe buprenorphine for the use of medication-assisted treatment. And this bill specifically applies to those who are working in community mental health centers or federally qualified health centers, and provides several conditions and limitations on that. First, the prescribing nurse practitioner or physician assistant has to work under the direct supervision of a licensed physician who has a Data 2000 waiver from the DEA, and that physician also has to actively be treating patients with buprenorphine. Additionally, that prescriber, either the nurse practitioner or the physician assistant, must apply for and hold an active Data 2000 waiver from the DEA. So that's an important thing that some of our practitioners will be going through in order to obtain that authorization. Additionally, the supervising physician in the facility can only supervise 4 nurse practitioners or physician assistants at one time. And again, this is in the community mental health centers and FQHCs, and the nurse practitioners and physician assistants who do prescribe the buprenorphine can only write prescriptions for 50 or fewer patients at one time. So you'll see in the next bill, those limitations are just slightly different and the setting is different. So Senate Bill 1938, House Bill 1980 allows these same practitioners who work in licensed OBOTs to prescribe buprenorphine in certain circumstances. Again, the nurse practitioner or physician assistant has to work under the supervision of a physician with the waiver from the DEA and who is actively treating patients with buprenorphine. The nurse practitioner and physician assistant also has to have the same waiver through the DEA. The differences really start when it comes to the supervision. The physician who's supervising those practitioners can only supervise 2 nurse practitioners or physician assistants at one time, but the amount of patients that they will be able to prescribe to evens out with the limit of 100 rather than 50. So the number of patients who can access these practitioners in both settings are the same. It's just the supervision and patient to prescriber ratio is different. This bill actually goes a little further as well and prohibits cash only or the use of prepaid gift cards and debit cards and credit cards to pay for services. The only exception to that is using cash or prepaid cards of some sort to be able to pay for a deductible or copay. So in order for someone to use one of those payment methods, they would need to use that for their insurance portion. They would not be able to use that for just the service of getting the buprenorphine treatment. It also requires licensed OBOTs to be credentialed and seek reimbursement for the services they provide through TennCare. I would really encourage you, if you are a community mental health center or FQHC or licensed OBOT, again, Public Chapter 761, Public Chapter 771, I would encourage you to read through those pieces of legislation and look at the conditions and limitations that are outlined there. Finally, on this section, Senate Joint Resolution 181 is, again, another policy position by the General Assembly in saying that substance use disorder and opioid use disorder should be insured and treated in the same manner as other diseases, and diabetes and heart disease are listed as an example. So a desire by the legislature to see prior authorization requirements removed in certain situations, and also certain type of parity when it comes to reimbursement for those services and treating those diseases in the same way that we treat other physical diseases in healthcare in Tennessee. Moving on to the general health, health insurance, or health administration related legislation. There are a few bills that extend programs that are managed by TennCare, the Cover Kids, and Access Tennessee. Programs were extended until June 30th of 2025. And then moving further down the list, Senate Bill 2022, House Bill 2170 is the Annual Coverage Assessment Act, where our hospitals use funding to draw down federal funding, and it's a very important revenue generator for our hospitals and the Division of TennCare within the Department of Finance and Administration. And other bills on there, but that's the one that I will highlight for this group. Under the state government-related legislation on page 5, you'll see the first bill that's listed as a sunset law. All state government agencies and boards and commissions are subject to a sunset review cycle. So each agency, board, commission expires after a certain amount of time and then goes through a review and legislative process that includes a performance audit to determine the amount of time to extend that particular agency. And just for your awareness, the Department of Mental Health and Substance Abuse Services is in the process of our sunset review right now, and there will be more about that in the fall and then also next legislative session. But you'll see Senate Bill 1655, House Bill 1733, and now Public Chapter 611 extends the Board of Social Work licensure to June 30th of 2026. And then further on down the list, you'll see other state government-related pieces of legislation that you might find interesting as you review this document. Under criminal justice and juvenile justice legislation, I'd like to point out Senate Bill 2734, House Bill 2517, which is the last bill listed, now Public Chapter 803. This is a bill that revises several sentencing related laws to the drug-free school zones and school safety zones. Typically in these areas, the sentencing requirements for individuals who are convicted of distributing certain controlled substances in those drug-free school zones and school safety zones are enhanced, and the legislature made various changes to those sentencing guidelines. So the folks that are interested in criminal justice reform and sentencing reform may be interested to take a further look at this piece of legislation. There are others on the list, but those are the ones that I wanted to highlight for you. I'm happy to answer any questions. I'm going to unshare my screen now, so if someone did say something in the chat box, I'm happy to take a look at that, but I'm absolutely happy to answer any questions.
Thank you, Zach. Appreciate that. I'm looking at the chat box and I don't see any questions. Does anybody have any questions for Zach?
I did see one pop up.
Yep,
this document is posted on our website. If you go to the department's website, at the very bottom, there is a footer with several links, and the header on the particular footer where this report is, I believe, says "Stay Informed." I want to make sure that I'm correct on that. And you'll see a link under that header that says "Stay Informed" to the 2020 legislative summary. So that summary will be available on there, and it'll pull up in a PDF. And it looks like there's a link also that's posted by our communications director, Matthew Perry, has put a link to it as well. So feel free to use and distribute that as you wish.
Thank you, Zach. Any other questions for Zach? All right. If there are no other questions, we will move on to the
Kim?
Yes.
We just got one question in from Amy Delinky.
Oh, okay.
It says, are we expecting to see any bills that address the healthcare professional exemption in the FFCRA?
So, Amy, I would refer you to the House bill. I believe it is 8002. I'm going to double check really quickly. The legislature at this moment is specifically limited to being able to address the topics that are in the governor's proclamation for the special session. And in House Bill 8002, there are definitions for healthcare providers in Section 9 of the bill, and that may be part of what you are looking at related to who may deliver and provide telehealth, telemedicine services for the purpose of our state. I hope that covers any question.
Amy said, thank you, Zach. Any other questions for Zach related to legislative proposals or the bills?
Hey, Kim, this is Kurt. I've got a question.
Hey, Kurt.
Hey, Zach, when is your birthday?
Well, so my birthday is Friday this year, and I'm very sad that I will not be once spending my birthday with Region 2. They provided some wonderful birthday treats for me last year, and I always enjoy being in Knoxville. So I'm sad that I will not be celebrating my birthday on that specific day in Region 2 this year. But it is Friday, and thank you, Kurt, for the reminder to all the folks here on the call.
Happy birthday, Zach.
Yes, happy birthday, Zach. Thanks, Kurt, for letting everybody know. All right.
My pleasure.
I believe that takes us to the assessment and stabilization teams that is going to be presented by Dr. Bruce Davis with the Department of Intellectual and Developmental Disabilities. I also see that Trey King is on the call today, and I just want to say that these two guys have done a great job trying to get the word out about the new assessment stabilization teams kind of meeting in all the different regions, meeting with law enforcement, mental health centers to address, basically to share the information about these new teams that are going to be put in place. And so with that said, Dr. Davis, I will turn it over to you. I believe you have a document that was sent out, and I'm not sure if you have it where you want to go ahead and share with us.
Yeah, actually, Michelle Babby is with us today, too, and she's been very instrumental in putting this program together as well. And she's going to share while I talk a little bit, but I may bring she and Trey into this as well. I was reflecting a little bit this morning because my grandson was over here and actually was telling a couple of dad jokes to him that I thought were pretty good. Probably somebody out there knows this one, but why was 6 afraid? Anybody?
Because 7, 8, 9.
You got it. You're a dad joke expert. Whoever said that. Yeah, we got several that knew that one. That's pretty good. I have tried to specialize in dad jokes over the years, so I'm really happy that a lot of people like those. That's a good thing. So we just wanted to take a few minutes here. I don't want to take up too much time with dad jokes because we only have 15 minutes, and we want to talk about these assessment stabilization teams. And we are really excited about the project that we have upcoming. We are developing these assessment and stabilization teams to address problems with the mental health response for people with intellectual and developmental disabilities who also have co-occurring mental health disorders. And so we're developing this concept to try to address those issues and hopefully more efficiently and more effectively than we have in the past. And so let's see, you've advanced already, Michelle, to the data. This just gives you a little bit of information about what we have been experiencing through people who are in services. Now, I don't want to act like this represents everybody who receives services. This doesn't even have the other waiver programs in it, but it has the DIDD waiver programs. And so of those folks, we had 314 hospitalizations in FY 2019. We haven't quite gotten our totals yet for FY 20. We had 724 crisis calls. One thing to note about this graphic is that we had a lot fewer calls in East, even though we serve more people in East Tennessee than we do in West Tennessee.
I hadn't seen. Okay. Bye.
Oh, somebody else kind of checking in there. Okay. So assessment and stabilization teams. Basically what we're talking about here is having 5 teams across 5 regions statewide. And so we're going to have those, they're going to be virtual offices, so it's not as if they're going to be in a specific space, but they will be centered around Memphis, Jackson, Chattanooga, Nashville, somewhere in Upper East. We're still analyzing the data to try to figure out what the right center for these spots are, but of course this is where our major population centers are. So this is where we're generally planning to establish. The objectives of these teams. So what we want to have are people who can have greater involvement in crisis stabilization in real time. That's a very, very important aspect of this. We want to make sure that we have people available 24/7 so that, you know, if it's happening in the middle of the night, that we're able to respond to those circumstances. We want to do a lot of cross-system stabilization planning. It's really awkward, and it's very difficult to avoid the word crisis. I really do try to avoid that, though, because I think our primary aim is to get people stabilized, get them back into their daily life routine as quickly as we can. And so you'll see me using that word as often as I can when I talk about what we're doing. But essentially cross systems, making sure that everybody knows what their role is when there's a crisis. And, you know, there are people with IDD who do have mental health, co-occurring mental health disorders who may occasionally need hospitalization. And so we want to make sure that when that's the case, that we've coordinated with the hospital, that we, you know, that they know what we're doing, that mobile crisis knows what we're doing, and that we're all working in concert with one another. And then they're going to have daily contact with an interdisciplinary team to just kind of staff any cases that they have where things might be occurring that might need to be responded to, might need to be diverted in some fashion, maybe to a respite or something of that nature, or to Harold Jordan Center, which is a facility that we hope to have up and running well in the next few months. So those are some of the objectives that we have. I mentioned strong community inclusion values. So over the course of the last several years, the Department of Intellectual and Developmental Disabilities has pretty much closed most of its institutional facilities. And so as such, a lot of people who might not have lived in the community previously are now living in the community. And maybe there are some challenges there that we have to work out in order to be able to serve people effectively. But that's our aim with this program, is to do strong community inclusion. So in other words, we don't want to see people reinstitutionalized. We don't want to see people spending a lot of time in psychiatric hospitals. We want to get them treated and back into the daily life routine as quickly as we can in the community. Clinical education and consultation networks. We do something called the Clinical Consultation Network. We're going to be doing one today, actually, at 12:30 p.m. Central Time. Most of you may have received a link for that. Michelle's really good at posting the links for things in the chat box if you're interested in attending today. Our commissioner is going to be my guest today on the Clinical Consultation Network. So we're just going to talk to him about some of our plans and his vision for clinical services going forward. So if you're able to attend, that would be great. But we're going to actually have more of these across the state as we develop this concept. And we're going to have some in each region that will bring partners together. Hopefully, you know, after this COVID thing, we'll be able to do it in a real space, not on a online meeting, but to the extent that we can bring partners together from areas where they need to work together. This is a really important part of what we do with this program. And then formalized network building, as was mentioned as we stepped in here, that we've been trying to go across the state, meeting with all the mobile crisis providers, all the regional mental health institutes, private hospitals, and others who are involved in crisis intervention, and developing memorandums of understanding, or what we're calling partnership agreements as we move forward. These are not legally binding agreements, but just agreements that we have on how we're going to work together to try to support this group that we serve. I talk about this in terms of constellations of support. So I'm kind of trying to move away from the idea of continuums of support, because there are different things people need at different times. So it's not just one dimension, it's multiple dimensions. And so that represents more of a constellation to me. We have a lot of things that are going on right now that we use in our system. And so we kind of have the basic structure of what we need. It's just that a lot of these things need improvement. And so that's what we're going to really work on as we move forward with these teams that I'm referring to. So I like this constellation. This is Orion the Hunter. And when I look at the one on the right, I look at it and I'm not sure I quite see a hunter. Even the one on the left with the dots connected still doesn't quite look like a hunter. And what we want to do, I guess, is fill in the gaps so that our constellation of support represents what it really needs to represent to support people with IDD. This slide just shows you the assessment and stabilization team structure. We have five teams composed of 4 facilitators each. So these assessment and stabilization facilitators will be people who are able to go out on site. We will have someone from each of these regions on call at any given point in time to come consult with mobile crisis or with whomever else might need consultation to try to figure out what the best thing to do for a person that you may be dealing with, whatever they need. And so these folks will be very well equipped with what the resources are that might be available to divert crises, to maybe try to keep people in place more. These are things I think these groups will be able to do. And so this is basically the structure of those programs. Assessment and stabilization facilitator is going to basically, actually she moved forward because I was already describing this. We're going to respond to crisis calls, develop stabilization plans, treatment center discharge transitions, formal daily consultation with treatment center IDT, and team building. Those are going to be some of the duties that they'll have. The manager is going to manage, basically going to coordinate the schedule, make sure everybody gets their training, participates in the daily contact with that interdisciplinary team that I was talking about, and just basically assist the facilitators in overcoming barriers that they may experience. The clinical directors is going to be basically a central office position here, going to hire and supervise the managers, develop policies, establish the clinical education events that I was talking about earlier, coordinate staff and partner training. So one of the advantages of this is we'll be arranging training for our partners, those people that we have partnership agreements with. And so so that those entities can learn more about people with IDD and how to support them effectively. And so then this clinical director will oversee the partnership agreements and evaluate data, make changes to the program as needed. And this is one of the great advantages of working with an agency that we're going to be working with named START, which is a national program that does training for these types of crisis teams, and that they have a national database that we'll be able to participate in and allow our program to be compared with other programs across the country that are providing similar service. So that's going to be one of the great advantages of the program that we're putting in place. So where are we now? I think we have our state and federal funding approved for this. We feel pretty confident now that we're going to be able to proceed with this. There were questions about that. Obviously, we all know that the budget had to be evaluated again because of the COVID-19 crisis and the loss of revenue that we had during April in particular. We seem to be on a good footing now to continue with the program, so we're very excited about that. We've begun getting our job descriptions together, working with our Department of Human Resources to have those approved, and so we're moving forward with establishing the program essentially. As I said, we've already been meeting with crisis entities to identify gaps in the crisis system and establish these partnership agreements and offer some training to them. And if any agencies out there even now are interested in some training on intellectual and developmental disability related concerns, mental health concerns in persons with IDD, other training that we might be able to provide you, we will start arranging that now. As I said, training and certification is going to be provided by the Center for START Services. So that is a national program. It's a great program. If you want to learn more about it, I encourage you to go to their website and see what they have to offer. We're also exploring the addition of 2 behavior respite locations in Memphis and Chattanooga. So we have 3 locations currently, one in Nashville, one near Jackson in Bolivar, and one in East Tennessee at Frontier Health. Those exist now. We're thinking of adding 2 more so that we have one for each team that is operating out there. And, now what we want to also do is make sure that these respite locations get used appropriately. Unfortunately, they've been used a lot post-hospitalization. We want to see them used pre-hospitalization much more than they have in the past. Yeah, and so we want to make you aware of this resource that's out there, these mental health and intellectual disability webinars for mobile crisis responders. This is a 6-week web-based training course for mobile crisis responders. Each of the mobile crisis groups that we have met with, we've encouraged them to get at least one person on their team who has received this training so that they can kind of be a liaison with our teams going forward. But this is a really great training. I think it gives you a lot of insight into mental health disorders and people with IDD and just, basic ways of responding and types of systems that we need to have in place to address the needs of this group. They also have one that is focused specifically on case managers, coordinators and case managers. So, this is a similar course. And so in either of these, I think you would find very helpful depending on what your job duties are in being a good partner with these teams that will be out there. And I think being aware of the resources, being aware of how we can work together to create a better scenario for this group. I already talked about the Clinical Consultation Network. We actually do it every Tuesday. We just happen to have a very special guest today in Brad Turner, our commissioner, who is very motivated, very supportive of everything we've been talking about. And so we'll be talking about that some today, as well as other topics related to COVID-19 and everything in between. But this is a great resource. I hope that you will take advantage of that and visit us from time to time on the CCN. Questions that you may have?
Michelle, I noticed that you put in the chat box that you're going to post the link for the CCN. Are you going to do that in the chat box after this?
Yes, I'm working on it now.
Okay, great. So for everybody's information, you'll see in the chat box here in just a little bit the link to the CCN, and Anybody have any questions for Dr. Davis, Trey, or Michelle?
Hey, Kim.
Hey,
I just would
Michelle.
like to say a huge thank you to Dr. Davis and his team. They have worked so hard on what he has discussed, and they have been great partners and truly caring and dedicated about the people that we serve collectively. They've got an incredible commissioner, so anyone that can listen in today, I would encourage you to do so. Commissioner Turner is extremely inspiring. I have really enjoyed him as my colleague, so I just want to say thank you to them.
Thank you so much for that, Marie. And I can't say enough about our partners, the Department of Mental Health, as well, because Melissa Sparks in particular, Jeff Fikes, have been members of the Tennessee NAD organization, which is the Tennessee chapter of the National Association for Dual Diagnosis, which actually has its conference coming up on August 20th, an online conference. And if you want to learn more about that, go to tn-nadd.org. Shameless plug there. But I do want to say so much, Marie, how much we appreciate the partnership that we have had over the years. And this is the culmination of that. I think, I don't want to say culmination because it's not, it's actually the beginning. It's the end of the beginning or the beginning of the end. I don't know what it is, but it is where we're, I think where we've been wanting to go with this. And I think this is going to substantially improve the service system for this group, and it will be all due to the partnership we've had with the Department of Health. No question about it.
Yes, sir. Well, thank you so much. I agree, Bruce. I agree.
Thank you, Bruce.
All right. Thank you very much. It looks like Michelle has posted the information. She's also posted the information related to the crisis training that will begin to start on October the 6th. And so thank you again for sharing that information. As we prepare to wrap things up and adjourn today's meeting, if you have any questions or comments, please send that through the chat box. Commissioner, before you leave, do you have anything else that you would like to say to the group?
No, ma'am, just really very grateful to be a citizen of Tennessee and grateful for all of the people that continue to serve those in need in our state. It's a great state to be in.
Absolutely. I completely agree, and I'm pretty sure everyone else on this call does as well. What I'd like to do is start wrapping things up and just say thanks to all of our presenters. You had great information for us as we continue to do business across our state. And thanks for all of the guests. We had a wonderful turnout with all the different people here for our meeting, for our guests and our members. And as always, I just want to thank the people of the department, especially the planning department, Avis, Kirby and Amy and Kurt, Zach, all of you guys. I wish I had you with me every day because you make this so simple for me to do with this current position that I'm in. And you guys, do a lot of preparation to make sure that we have a successful meeting. And I just want to say thank you to that. The next information that I have is that our next meeting will be held on December the 15th from 10 a.m. to 1:30. As of right now, the plan is to have that at our normal meeting place, which is Middle Tennessee Mental Health Institute. And everybody, we will keep you updated as to if it will stay as well or if we will actually be able to meet again in person. My hope is that we're able to do that, but we definitely want to follow all the procedures and keep everybody safe. So we will keep everybody informed about that meeting on December the 15th. At this point, in Avis, Kirby, do you guys have anything?
Kim, this is Avis. I don't have anything to add. Just want to thank everybody for joining, as Commissioner said, for the meeting today and taking time out of your schedule to be with us. I hope the information was very valuable to you. I'm sure it was. And I wish everybody a great rest of the week.
Hey, Kim.
Hey.
Kirby. I don't have anything to add. I just want to let everyone know that all the information that was shared, links and such in the chat box, I want to be sure. Want to send me your email if you're not a member of the Aggressive Statistics list or member list, please send me your email and I'll be happy to share the information.
Thanks, Kirby. Also, one last reminder is if you called in by phone, please make sure that you follow up with that email to Kirby, kirby.fi@tn.gov. And so with that, we will take a motion to adjourn today's meeting.
So moved, Debbie Hillen.
Thank you, Debbie. And do we have a second?
Second, Mary Nell Osborne.
Thank you, Mary Nell Osborne. All right, if there are no objections to adjourning, I'll give a second to see if there are any. And we will, all right, looks like there's no opposition to that. So it looks like we will adjourn to this meeting. Again, thank you all very much. Be safe, and thank you for the services that you provide.
Good meeting, Kim. Thank you.
Thank you, Kim. Great meeting.